So in secondary syphilis, we'll again do a little revision. It is also known as metastatic stage, appears after 6 to 8 weeks of appearance of primary chancre. It is three lesions are there. There are skin lesions, mucosal lesions, and the other is generalized lymphadenopathy. In skin lesions, there are two, which are nodular and flat papillary, which is also known as condyloma lata or pustule lesions. There is another cone-like lesion known as circinate, which is seen on face as a characteristic secondary syphilis sign. You'll see hyperpigmentation of palm and soles. There are many symptoms associated with secondary syphilis. Those are headache, anorexia, fever, joint muscle pain, laryngitis, pharyngitis. The pain is discrete and not fixed to the surrounding tissue. Lymph nodes. In secondary syphilis, oral manifestations are mucosal patch on larynx, gingiva, tonsil, pharynx, and cheek. These are irregular or circular, slightly raised, painless, round lesions. These mucosal patches are usually covered with yellow and grey glistening slough and have a painful erythematous halo. These mucosal patches in oral cavity coalesce and form snail track. Tongue is often fissured. Oral condyloma lata, often present, round and pale. Oral condyloma lata is flat papillary lesion of skin. Latent syphilis, it is a hidden stage where when the secondary symptoms disappear, the bacteria begins to infect the bone marrow, lymph glands, vital organs, and central nervous system. It may last up to a month or for a whole lifetime. 1/3 of the cases left untreated will proceed to the tertiary stage or the late stage. The tertiary stage has ये after 5 to 10 years of primary infection होता है. It mainly affects nearly all organs of the body, mainly the CNS, CVS, and the mucosal membrane. There is a typical lesion of tertiary syphilis known as gamma, which is a localized chronic granulomatous lesion having either nodular or ulcerated surface. Is a typical lesion known as gamma of tertiary syphilis. It may be chronic granulomatous. There will be granuloma formation. It will be ulcerative lesion which also appear as punched out ulcer having vertical walls and a dull red granulomatous base with an irregular outline. Skin lesion heals very slowly and often leave a tissue paper like scar. In the tertiary syphilis occurring during pregnancy often result in congenital syphilis of newborn. The most serious complication of tertiary syphilis is destruction of walls of large blood vessels resulting in an aneurysm or cardiac insufficiency. Involvement of central nervous system result in paresis, dementia, and strokes. The old manifestation of tertiary syphilis are gamma, seen on the hard and soft palate, lip, and tongue. This is not a contagious stage. Lesions are firm, small, pale, and nodular. They usually in the midline of palate. They frequently ulcerate by central necrosis and have punched out edge with washed leather floor. The ulcers are single or multiple, mostly painful. In tertiary syphilis, progressive necrosis and slugging often leads to perforation of the palate. In the tongue, often there is a presence of superficial glossitis, or it is also known as syphilitic or atrophic or intestinal lutic glossitis. Ignore that. Loss of filiform and fungiform papilla, and somehow it resembles squamous cell carcinoma. Let's just do a quick division of tertiary syphilis. 5 से 10 साल बाद आफ्टर प्राइमरी सिफिलिस. टर्शरी का typical lesion is gamma, which have punched out which look like a punched out ulcer, irregular base, irregular outline and granulomatous base. In tertiary if people like if a woman is in the phase of tertiary syphilis and she is pregnant, the newborn will also have a congenital syphilis. There it maybe have many serious complications such as destruction of the wall of large blood vessel causing aneurysm, or cardiac insufficiency in central nervous system. If it is acting, dementia and strokes can be seen. In oral manifestations of tertiary syphilis, gamma is seen on the hard palate, soft palate, lips and tongue, mostly seen in the midline of the palate, and the lesion is firm, pale and nodular. The lesion is frequently ulcerate by central necrosis and punched out wash leather appearance. Single or multiple it can be. Mostly they are painless, and perforation of palate can happen. You can also, in tongue you can also see loss of filiform papilla and fungiform papilla, and superficial glossitis, and it also somehow resembles to squamous cell carcinoma. In congenital syphilis, it is very rare. It only happens to the children born to a syphilitic mother. Condition occurred due to transplacental infection of the trypanoma pallidum during fetal development. What happens is so first is either the baby will die, prenatal death, premature delivery, low birth weight, and congenital anomalies. So 2/3 of the live born neonates with congenital syphilis are asymptomatic at birth. Overt infection can manifest in the fetus, the newborn or 6 to 8 weeks तक हो सकता है कोई साइन ही ना हो. Early congenital syphilis is before or equal to 2 years of age, and late is after 2 years. Clinical manifestation of congenital syphilis are condyloma lata, वही skin lesion का flat papillary part, maculopapular rash, hepatosplenomegaly, jaundice due to hepatitis, anemia, osteochondritis, pseudoparalysis, lymphadenopathy, mucosal patches. And now the clinical manifestations of late, these were of early. Early होगा तो hepatosplenomegaly, lymphadenopathy, mucosal patches, condyloma lata, maculopapular rash, osteochondritis, anemia, jaundice. And in late congenital syphilis, you'll see frontal boozing, saddle nose, this would be saddle shape, short maxilla, high arched palate, relatively proganthism of mandible, Hodgkin's tooth. Hodgkin's tooth में mulberry molars, Hodgkin's incisor. 8th nerve deafness, interstitial keratitis. Then you'll see scaphoid scapula, the concavity of the vertebral border of scapula. And then you will see in Hodgkin's triad, you see 3 things that are Hodgkin's teeth, 8th nerve deafness, and ocular interstitial keratitis. In Hodgkin's teeth, what we see is screwdriver appearance of the teeth. The first we'll see is straight edge screwdriver appearance of the middle lobe. The incisal edge often exhibit a central hypoplastic notch. Mulberry molars taper towards the occlusion. Constricted grinding surface, the occlusion anatomy is abnormal. Numerous disorganized globular projections are there. In interstitial keratitis, at the not present at the butt, but usually develops between 5 to 25 years, may go blind. The person may go permanently blind. Histopathology of this is during first 2 stages the pattern is similar. Surface epithelium is ulcerated in primary lesions and may be ulcerated or hypoplastic in secondary stage. The underlying lamina propria demonstrate increased number of vascular channels and intense chronic inflammatory reaction. Next video.